All right, Candace, thank you so much for joining us. It's always important to remind people about stroke awareness, and it's a big problem in Mississippi. I mean, numbers are pretty high for things like stroke and heart disease in
Yes,
Mississippi, even more so than other parts of the country.
It is, absolutely.
And what are the two types, first of all, of stroke? Because they're both very different and they're treated differently and they have a different effect on people.
Yes, ma'am. There are two different types of stroke. One is ischemic stroke, and that's when the blood clot, a blood clot or an embolus can form in the brain, so the vessel is actually blocked. The other type of stroke is hemorrhagic, and that's when the blood vessel actually can burst and there's bleeding in the brain.
And I guess really the most important thing, if you think you're having a stroke or you think your loved one is having a stroke, is to act fast. And in fact, that's one of the acronyms, Be Fast.
Yes, ma'am.
And it has each letter stands for something.
Yes, ma'am.
And that's important. That would be a good thing to run through.
Yes, ma'am, absolutely. So Be Fast, it's something easy to remember. B stands for balance. So if there's a sudden change in balance, E stands for if they have eye issues, so a change in vision. F stands for face, so if they have any kind of change in face, they're like a facial droop.
Any kind of paralysis in the face?
Yes, ma'am. A stands for
Arm
if
weakness?
they have, yes, ma'am. If they have weakness in one arm or the other. S is for speech, so if they have a change in their speech, like a slurred speech. And then T is for time, because time is brain, and you always want to make sure that you're calling 911 immediately if they have any changes.
So don't waste time.
Correct.
What
Yes,
kind
ma'am.
of difference can that make?
A matter of minutes can make a huge difference in their treatment. The quicker we treat it, the less damage to the brain. So absolutely, time can make a huge difference.
And as far as prevention, sometimes it can't be prevented no matter what you do, but living a healthier lifestyle, keeping an eye on your blood pressure, those things do help a lot, don't they?
Absolutely. There are different risk factors that patients can have. Some are non-modifiable, like your age, your ethnicity, or your sex, and then some are actually modifiable. So just having a healthier lifestyle, not smoking, not drinking a lot, and then treating your blood pressure, like you mentioned. Hypertension is a huge item that can affect a patient, and making sure that that's under control is very important.
And I know that you all recently developed more of a 24/7 stroke facility at Memorial.
Yes, ma'am. We are a primary stroke facility, but we recently had neurointervention added back to our hospital, and that just allows for more coverage and more capabilities for treating stroke patients.
Okay, well that's great to know, and these are some great tips from Candace Middlesdorf, an RN and also in charge of the stroke program at Memorial. Thank you so
Yes,
much
ma'am.
for joining us.
Thank you so much for having me.